In the east of the Democratic Republic of Congo, ICRC teams carried out a study between April and May 2025 on 109 health facilities in North and South Kivu provinces. The study reveals a general deterioration with the risk of collapse of parts of the health system in the areas most affected by conflict. Access to healthcare is severely limited and medicine is running out, putting thousands of lives at risk. Here are 3 things to know about the current situation. 1. Health needs on the rise. Armed conflict has led to a surge in medical needs. For example, in the first quarter of 2025 alone, more than 2,350 weapon wounded were treated in ICRC-supported hospitals. That's a 172% increase over 2024. Mental health consultations for victims of armed conflict and sexual violence have increased 7-fold in some areas compared to the same period in 2024. 2. Access to healthcare is increasingly difficult. Between looting, destruction of health facilities, flight of medical staff, but also complicated transfers of the sick and the wounded, and even difficulties in transporting medicines, healthcare is becoming increasingly difficult to access. For example, in most of medical facilities surveyed, the number of consultations of vaccinations for children has dropped by half compared to 2024. Another chilling figure: there has been a 4-fold increase in the number of stillbirths in facilities included in the study. 3. Health facilities are short of medicines. According to the ICRC study, 3 out of 5 health facilities have been looted since the conflict intensified, drastically reducing their stocks of medicines. In addition, it is becoming increasingly difficult to transport medicines from one area to another, even more so with the closure of Goma and Bukavu airports. Nearly 3 out of 4 structures covered by our study are experiencing drug stock shortages due to the impact of conflict, but also due to the reduced international aid budgets, a situation that will affect millions of people.